Infections are a fact of life. In fact, there are millions of tiny bacteria living on your skin at this very moment. These bacteria are usually harmless, but they can have serious consequences in the healthcare environment if they are allowed to multiply and spread. Keeping this environment clean and tidy is one of the best ways of reducing the risk of infections such as MRSA. As a member of the domestic staff, it is your responsibility to show good cleaning practice and help prevent infections. This video will help you understand how to protect yourself from infections at work and how to clean effectively so that you do not allow bacteria to multiply and pass on to others. As part of your induction training, you will be introduced to a number of policy documents. These will include your employer's cleaning policy, which should feature a colour coding system, a health and safety policy, and an infection control policy. Under the Health and Safety at Work Act, you are required to work in a way that ensures the health, safety and welfare of others at work. If you don't abide by the recommendations made in your employer's policies and don't show good cleaning practice, you could break this regulation by putting both yourself and others at risk of infection. Good hand hygiene helps to control the spread of infection by removing bacteria from your hands. There are 5 steps in the process: wetting, applying cleansing solution, washing, rinsing, and drying. First, take off any jewellery you might be wearing on your hands and wrists so that you can reach all areas. Then wet your hands and wrists in running water. Apply a good quality liquid soap and rub it in thoroughly, paying special attention to your nails and between your fingers. Lastly, rinse off the cleansing solution in running water and dry your hands and wrists thoroughly with either paper towels or a hot air blower. It's important that you follow this process carefully, as your hands and wrists are places where bacteria like to collect and multiply. Always disinfect your hands when they are visibly dirty, before starting work, going home, going for a break, preparing or handling food and drink, handling any catering equipment, entering and leaving an isolation area, before and after any cleaning task, after handling a soiled item, handling linen, bedding and waste, removing protective clothing, using the toilet, blowing your nose. Remember, by following the rules of hand hygiene, you can help stop harmful bacteria from multiplying and spreading to equipment, patients, colleagues and others.